So next to the stage is Michael Ryan, head of the National Office of Mental Health Engagement and Recovery, and Jessica Curtis, the National Project Manager. So Michael brings his own lived experience of mental health challenges to his role, and now he enjoys this full life of recovery. And that's all everyone can be aiming for, going through our mental health struggles, but ultimately recovering, and that's what we're aiming for here. So Jessica is a national project manager, seconded to the National Office of Mental Health Engagement and Recovery by Genio, and her focus of her role is to co-produce and review the HSE's mental health service engagement structure and activities, and offer recommendations to that service for improvement nationally and focusing on enhancing the current model of engagement. So Jessica's studies, work and life experience support her interest in the joining of the dots between stakeholders, contemporary research, and beneficiaries for the system change. So Michael and Jessica will reflect on the history of engagement and enhancing engagement project. So I would like to welcome them both now on the stage, Michael and Jessica.
Good morning, everybody. It's good to be here, and you're all very welcome, and thanks for coming. And I always like coming to Athlone. They say it's the heart of the country. Now I'm from Mayo myself and Westport, and they say that's the best place in the country. But we have everything there except one small piece of silverware that's missing for a few years now. But they say in recovery that hope is very important, and we have that hope every year. So one of the days I'm going to be saying, we don't need the hope anymore because we have the reality. But we're at the heart of Ireland, as they say, geographically. But I think in engagement, has to be the heart of mental health services, because what it's about is about bringing everybody together to try and to find the best outcome, the best solution for people using our services. And today we're going to talk a little bit now about what is mental health engagement and recovery. As I said, I'm in the role of Head of Mental Health Engagement and Recovery since 2019. And why did we establish the office? What is it about? So the Office of Engagement and Recovery is about ensuring that lived and recovery experience is at the heart of a recovery-orientated service. And because, in any business, it's your customers that you think about. What do they need? What are the outcomes we want? And that's the way we need to look at our mental health services as well. What are the outcomes that the people using our services need? And what they need is a life of their own choosing, to be the best person, the best version of themselves that they can be. And that's our work in mental health engagement and recovery, is to help our services achieve that for the people who use our services. And we cannot do that alone. We can only do it in partnership with all other stakeholders. And it's not about the promotion of one particular expertise over another. It's about all working in a co-productive process. So it's about the optimum use of clinical excellence, of lived experience, of occupational experience, of social experience, whatever it is, everybody coming together to produce the best outcome we can for people. And the programs of work that we oversee in engagement and recovery are very much focused on that, as Tony referred to. We have been commissioned with a number of the sharing the vision recommendations. And that's a great endorsement of our work, that it's recognised that the best office to drive this is the Engagement and Recovery Office. We oversee peer support. There's many peer support colleagues here today. You're all very welcome. Recovery education, there's many recovery educators. Our engagement structures, what today is about. And there's people involved in engagement here today, and you're all very welcome as well from our forums and other engagement initiatives. So that's what our office does. As I said, I'm the head of the office, and I have a team around me. Jessica is part of that team. Fiona McKiernan, Michaela is here, Debbie, John McCusker, Michael Norton. So, there's a big team involved. And at an area level then, we have area leads for engagement. I know there's a couple of them here today. We have recovery coordinators, recovery educators, and we have our mental health forums, both local and regional. So this is, a movement and a journey that we're on. And, as I said, I like coming to Athlone because this is where the journey started from. About 9 years ago, we had our first conference here, our ARI conference as it was at the time. And I was probably the only person in the role then who was brought in specifically for their lived experience. But today we have around 200 people involved in the work of engagement and recovery. It's an important part of our national policies and strategies. It's an important part of a lot of our regular staff's work. So it's important to acknowledge that as well, because it's not always about where we're going. Sometimes it's important to look back and say where we're coming from, because it's from our journey that we gain our experience and our ideas and our values. So that's what we're trying to do with engagement and recovery. And I was told I only had 6 minutes, and I'm probably on to 12 already, but anyway. So the Engagement and Recovery Office was established in 2019, and the office was established to align a lot of this work that was going on in terms of we had the Service Reform Fund. I see my colleague John Healy this morning, a great supporter of us from Genio. We thank you for your support. There was the Advancing Recovery in Ireland initiative, and there was a mental health engagement structure. And all were trying to do the same thing, but all had, I suppose, started at a different timeline, had a different governance structure, and so on. So we needed to bring it all together into one cohesive function. So the Office of Mental Health Engagement and Recovery was established to do that. So nationally, we have achieved that in terms of the 3 teams that were working on those 3 specific projects are now united in one function. At a local level, we're still trying to develop that alignment fully. Progress has been made, but there still is work needed to be done. And we are now working on how to achieve that. There are representatives here from heads of service here today. Charlie and Pat have taken time out from very busy schedules because that's a sign of their commitment and the head of service group's commitment to this work. So you're very welcome, gentlemen, and thank you for coming. But we hope that events like this, where there are people from all parts of the work of engagement and recovery, will help us to improve that alignment piece. And it's a very important piece, and I know that it's a frustration for a lot of people, so we do acknowledge that. Just to talk a little bit about the mental health engagement stream and where it has come from. And it originated out of a document called Partnership for Change, and that was developed by a reference group of 13 service users and family members, supported by a couple of senior HSE staff. And that work commenced in 2014, and the office came into being in 2016, and it was commissioned by Anne O'Connor, who was at that time the National Director for Mental Health. So there was a big organisational commitment to do this, because it was informed by, international best practice, by our Vision for Change policy, which now, of course, has been replaced by Sharing the Vision, and that, a recovery-orientated service had to have at the heart the lived and the recovery experiences of people using those services. And so, the work of Partnership Change was, groundbreaking at the time. It achieved a lot, and it was, I had the privilege of being part of that group myself, and we had a greenfield site. And we came up with a model that we thought was the right one and the best at the time. And since then, it's been tried and tested, and we have proved the concept that, engagement with all stakeholders works, and involving service users, family members and carers. But it wasn't perfect. Nothing is perfect. So we felt now is the time to review it and to try and ensure that we're getting the most effective form of engagement that we can. It's delivering, the best outcomes. And, this was a concern of us nationally. It was a concern of our heads of service colleagues. And we had the experience of the Service Reform Fund, the Advancing Recovery in Ireland project, and the mental health engagement experience as well. And I'd like to acknowledge, my predecessor, Liam Hennessy, who was, the former head of mental health engagement, for the work he did. And for the area leads, many of them have moved on to different positions and posts now, for the pioneering work they did. But as I said, it was very much a concern for us that we get the engagement structures right. So we talked about it nationally, and we talked to the heads of service about it, and we talked to Genio about it, and we came up with the Enhancing Engagement project. And that project specifically is looking at ensuring that we're very clear what we mean by engagement. We're very clear about how it works. We're very clear about how it is resourced, and we're very clear about how we measure it. So we want to know that engagement is working. And when we have those structures in place, then we can apportion more accountability and responsibility. So Jessica was brought in as the project manager, and I'd like to acknowledge all the work that she does. And our understanding of engagement has evolved. So it's not just about, if you read some of the literature, it talks about, service users, family members, care informing the design, delivery, evaluation of services. And that is very important. But, it needs to be at a much more integrated level than that. Engagement needs to be happening up and down the country today, in clinics, in acute units, anywhere there is a relationship or an engagement between a service user or family member and the services. There has to, that's where engagement has to be, and it has to be about improving the quality of that relationship and that contact. And that's where we need to bring it now. So it's not just about the lived experience cohort, it's about, it's everybody's business, as we say, it's all our staff's business. So really, I think that's everything I have to say here this morning. And I, would just like to thank you all again for coming. It's very important that we're able to reconnect again after our years in the wilderness. And I'd like to thank Jessica for organising this conference along with the organising committee. And Neil, I see him here. Sushil is here. Kelly is here. Nuala. Liz isn't with us. Maria. Michaela, our admin. And of course, Jessica. And thanks to the hotel, and thanks very much for Pamela for her excellent emceeing. And I hope you all have a really good day and a very engaging one. And thank you all for listening.
Thank you, Michael, for leaving me very little time, which is great because I'm quite a nervous public speaker. Anyway, I'm Jessica, as I was introduced earlier on, and I'm here to tell you a little bit about what the Enhanced Engagement Project is. So you've heard a little bit about what Partnership for Change is, and a lot of you have been involved in forums over the years. Forums work amazingly in some parts of the country, and they don't work so well in other parts of the country. So what we're looking to do is hang on to what works and enhance engagement and offer new engagement mechanisms. I am working with a great team. If I could have that slide, that'd be wonderful. So I am working with a great team, a national steering group, which is made up of people from lived experience and people who work in services. We're working together on this enhanced engagement piece. And I apologise, I'm skipping a couple of slides just so that we can save a little bit of time. Thank you so much. I can use that one. So what we started out doing in the Enhanced Engagement Project is we put together a steering group, as I mentioned. I was appointed as a project manager. We established some principles underpinning our work to make sure that we were talking about recovery orientation, that we were really focused on respect and so on, and I'll talk you through those principles in a moment. We also started with the consultation piece earlier on this year. So we spoke to over 40 people who work in engagement and recovery or who use engagement and recovery services. And we asked them 4 simple questions. We asked them what works about engagement, what doesn't work about engagement, what are the structural barriers to engagement, and what are the new opportunities that you can see for engagement. And we got a lot of responses, which was wonderful. Some of those responses are on the table down here in the far right. You can have a look at them later on, and I'll share a few more with you as I speak. We also did a call out for good practice. So we reached out to CHOs, the community health organisations across the country, and we asked them, where engagement is happening in your organisation and it's going well, can you tell us about it and send it in to us, so we can have a look at what changes are being made by listening to people who use services. So we were really delighted and surprised to receive 90 submissions to that call out. And next year we're going to publish a booklet to share all of those ideas with you, so that might inspire new things that can happen in your local area. It might be something you're doing already, or it might be just a little spark of an idea that starts a new process of engagement in your area. Excuse me. We've also developed a model for engagement, and the reason I mentioned that, but we won't speak too much to it today, is that we're still developing it. That model is, we want KPIs attached to it, so those are key performance indicators, so that there is accountability in engagement in every single part of the country. At the moment, engagement roles exist and forums exist, but there are no KPIs attached to the activity. So as a result, as you know, in public sector, we're aware that if you don't measure something, it is not likely to be valued. So what we want to do is to start measuring the engagement activity and when I say measure, I mean not just that it's happening, but that it actually affects change. So the other thing that we're doing is engagement and recovery alignment sessions. Michael talked that a little bit earlier on, and that's to bring recovery functions and engagement functions together so that people with lived experience in the workforce are talking to each other, are working with each other. It's amazing that we have 200 people working in the HSC in these areas, but we need them to be connected in order for that to be a community that has a really influential voice in services so that they're able to affect change as well. And then, of course, the other piece that we've done since February, since we started only in February this year, is that we coordinated this conference today. So we're really, really thrilled that you're here today. Within the group that we're working with, we have identified that we need 2 subgroups as well. So we recognise that the youth voice is extremely important in mental health services, and we want to create an engagement strategy that's specific to youth voice, while working alongside a piece of work that is focused on adult services. And obviously we're in the 21st century, and we really need to be looking at digital engagement. In public sector, that's kind of sometimes a hard thing to do, but we've got some amazing people working in the HSE at the moment who I hope would like to volunteer to be part of the digital engagement subgroup, not looking in any direction in particular. But we're looking to develop that as well, to make sure that people who don't feel like turning up to a committee or don't have the energy to turn up to a committee or a forum are able to engage with us in a way that works for them. And we don't know if that's going to be Twitter, if it's going to be a health social type, Facebook type thing and so on, but we're going to explore it and try and find out what works. Okay? So I'd like to share with you a little bit about what people said about engagement in that consultation. I have a number of quotes here, but I'm just going to read one or two of them to you. So, I've been in and out of the unit and I've never heard of a forum. I have things I'd like to say, but I don't know where, maybe online. I don't have time to sit on a committee. That's from a service user. And from a family member, engagement shows family members that their loved one's recovery journey is important to the persons who provide the service and builds our trust in the service provider. And a staff member, when we asked what wasn't working about engagement, said we're being perceived as agitators or opposition, and we feel like there's no real accountability built into engagement. And there's no strategic measurable objective in local service plans. So I suppose I'm sharing those comments with you because we are addressing them, we're listening to them, and we are hoping to create an enhanced framework that works really well for everybody and hears the voices of all of those stakeholders that need to be heard. And I suppose what I'm going to finish with, if I could go to my final slide, that would be wonderful. And the quotes that are here, just so that you know they are, again, shared on the table down the end. So if you'd like to have a read and expand your knowledge a little bit more about what people are thinking at the moment, that would be really helpful. So anyway, I'm going to close with what the project's going to deliver in 2023. We're going to deliver a framework with recommendations for engagement mechanisms, which just means ways to engage with people and hear people. And within that, we're going to have agreed local and national key performance indicators for engagement and a reporting process for engagement activities so people know what's going on in their area and so that many people are accountable for that activity in that area. And again, that activity that will enhance, change and inform service improvement. We're going to produce that good practice booklet with examples from across the country so people can feel like they're not alone or that they're not at a starting point of zero, or if they want to do something innovative, that there are some ideas there for them to share. And then obviously we're going to continue with the alignment process, continue with engagement activities like these, and we are going to look at CAMS engagement mechanisms and digital engagement mechanisms. Thank you very much for your time. I hope that made sense in the short period of time that we have.